Hi, I'm Dr. Janssen. One of the things that brings patients into the office, people into the office, okay, is a pain syndrome. And so initially what we want to do is we want to reduce the pain as quickly and as efficiently as possible. The people that we see have a neuromusculoskeletal condition. There's a skeletal condition, which means we need to do adjustments. There's a muscle problem, muscles have shortened, they're overworked. And most of the time everything's chronic, so that it's been going on for a while, so their brain's involved in that condition. So one of the things that we do to help the muscles at the beginning is we want to relax the muscles, we want to increase the blood flow through the muscles, and we also want to trigger endorphin. Endorphin is the body's natural painkiller. So what we do is we do interferential. Interferential is an electrical therapy. Okay, sometimes patients jokingly say, "Oh, am I getting the shock treatment?" No, it doesn't shock you. Okay, it came out of Germany in the early 80s, and it was a major breakthrough in electrical therapy because it can penetrate deep into the muscles, where therapy in the previous to that, it couldn't penetrate past the skin, most of it. And so we use these sticky pads, okay, and when you come in and you have a pain syndrome and we start you on interferential, these sticky pads adhere to the skin, and then we use these leads, okay, to attach to the pads. Okay, now the treatment always needs to be comfortable. Okay, so we have some people that believe more is better, and they can turn it up so high that they can make the muscle go into spasm. You see, muscles contract and relax via changes of electrical charges. So we always want the treatment to be comfortable, but also sometimes the muscle will quiver. Okay, and because it contracts and relaxes via changes of electrical charges, we can put enough electricity in the muscle where the skin can, or the muscle can jump, and that can feel weird, but it should never feel uncomfortable. And now we're kind of particular on this. We use these pads, and when a patient comes in, we open up a brand new pack of pads and we put their name on it. So this is their pad. These are their pads. We don't transfer them to the hairy butt on one person, okay, and a neck on another. Okay, that's not what we do. Okay, so the pads transmit the electricity into the muscle, and interferential is very effective. I would say that the majority of people love the interferential because it provides relief and it speeds up the healing process. So we're here to help patients. Don't forget, I'm Dr. Janssen, your Clearwater chiropractor. Thanks for watching.
Okay.